Hello, everyone at MedLinks membership. This is Dr. Dawn Kyle, and I am here with Dr. Jennifer Pedley, who is going to share about a little bit about her skill set. That's something I think is extremely valuable that every doctor should be utilizing and thinking about in the personal injury space. And I'm not going to try and introduce it all myself. I'm going to let Dr. Pedley tell us all about herself and her skills and her credentials. And hopefully, this will give you some insight into opting to use her skills multiple times over as a MedLinks member and maybe be able to share her skills with other providers, other attorneys, other doctors that you know. So take it away, Dr. Pedley.
All right. Well, thank you, Dr. Kyle. So my name is Jennifer Pedley, and I'm a chiropractic radiologist, which we are known as DACBRs. And so my specialty is, of course, not only in chiropractic, but also in radiology. My clients are any private practice doctor, whether it's a doctor of chiropractic or medical doctor, but also I have clients who are attorneys. And I also specialize in the personal injury, and I have some clients too that utilize me for workers' comp. I went to chiropractic school at Northwestern, and then I did my radiology residency at National University. So sometimes I get that question of where did I come from? I'm a Midwest girl, but I've been in the beginning. I was right out of chiropractic school. I was treating patients. And then after 5 years, that I went into the radiology residency. So I'm kind of a what I call an odd duck. Usually, when individuals end their chiropractic their schooling, then they go right into radiology. I did the opposite. I went out in private practice, which I think helped me kind of hone in on not only my skills, but knowing what's extremely important for patient care and for managing their cases.
Absolutely. I think that
Yeah.
gives you a great insight, and you're absolutely right. So the difference is for those thinking about getting these studies done and these interpretations is that many of the radiologists, that do these studies have never been in clinical practice. And so they don't have that insight. So that's a really unique thing that probably most people don't know. So, yeah. How do you feel like that emphasizes your skill set for when you're doing your reviews and your reports versus not having had that experience?
Yes, my reports do have more detail than most radiology reports. I feel that because I was in private practice, there were certain things that I thought were very important that may not have been included in some other radiology reports. With in comparison to other radiology reports as well, I don't use vague terminology. I give measurements, and I'll state like these are the differential diagnosis. This is what could be done next. This is who you could refer to or things to look at further, maybe more globally. And I make my reports that are uh, more curative to whatever the doctor needs for their practice. So I'm not making up things, but there's certain chiropractic practices that really want specific information, which I am happy to accommodate.
I agree. And having used your services for some case reviews that I had to do, I definitely noticed that you go into much more granular detail that I think the eye of even physical medicine, pain medicine doctors, orthopedics, I feel like there's just a little bit more granular detail, and you have that eye that really helps you, even just with your diagnostics and your treatment protocols, and of course for your narrative reports and your forensic exams or trial cases or things that might come up that you need to use it as evidence-based. So I noticed that personally, and I
Absolutely.
want to let everyone know there is a difference. Even when I've had a radiology report from a general radiologist like MD, let's say, or DO, I could see that there was some things that as a chiropractor that I wish that I would have had more detail on. And so and that's a great thing to bring up that even if you've gotten a report from an MD or DO or another, if you're like, I think I want some more detail, you can still send them to you, correct? You can give a
Absolutely.
second,
Absolutely.
more deeper dive. And also, don't you, if the doctor wants to get with you on a call or something, you'll help them navigate through that, right? That's another service that you provide.
Absolutely. Yes. I'm very transparent where I have my contact information. I will pick up the phone. I will return your email.
Yeah.
And I look at it as teamwork. So I'm part of your team. I'm here to help you. And if there's something that needs to be further clarified, I can definitely help with that as well. And you're right. A lot of times the MD reports are just more vague, but that's because they are writing the report for the MD community. So do they
Correct.
need surgery? Do they need the oncology department? That's their concern.
Yep.
And most often PI is just not in their wheelhouse.
Right. Right.
Versus mine is just that's what I do. That's why we have more detail in these reports.
Absolutely. And that's a good point to make that, especially for maybe some people in our membership that are still in training in PI and they're wanting to level up their PI skills, is to know that not every viewpoint is going to be equal. Right. So
Right.
that, and we want MDs and DOs looking for what they're specialized in. Right. But you often will need someone like yourself, in my opinion, when you have especially those nebulous cases of like soft tissue spinal injury, low impact, where it's really difficult. You got to really dig into that diagnosis because it's not an obvious disc issue, it's not a fracture. And that's where the attorneys need more help, right? They need to understand
Absolutely.
it. And the chiropractors that want to quarterback these cases, which they should, they also need more granular detail so that they can make sure they're not missing any possible diagnosis that will serve this patient in their case. So that's great. Now, how did they get a hold of you? So in the MedLinks membership, they can reach out to you through the portal. And then they go, so how does it work as far as if I wanted to send a report to you to look over or viewpoint, can you walk me through that? And then how are you, what's your fee schedule typically or payment method?
Sure. You can reach me. I have my website, which is jprad.com. I do have my cell phone on there as well as my email. My email is jennifer@jprad.com. Just contacting me. I would prefer if we got on the phone to talk because everyone's X-ray systems, if you do have an X-ray system, in order to send me the report, or excuse me, the images, everyone is very different. Every system is very different. Or maybe you have a DVD and then you need to send me those images. And we have a couple of different ways, or a couple of different portals, rather, so that way it's HIPAA compliant. So
Mhm.
don't text me your X-rays. Don't email me your X-rays. We have a couple of portals that we can use, and that will allow me to then upload those images, and then I'll be able to do measurements, change in contrast. I can then manipulate the images, and it's high resolution as well.
Oh,
So
great.
yes, so that is the preferred method. You had mentioned about fees. It does vary anywhere between $30 to $40, just depending on the amount or the amount of time that I'm spending, or if it's a comparative report. And this is about X-ray, so anywhere between $30 to $40 per region. So
Okay.
cervical would be 30 to 40, thoracic 30 to 40, lumbar, and so forth.
Okay.
Now, if it is a comparative report and you want an MRI with that, then MRI is $100 per region for that report,
Okay. And
just in
then,
case.
yeah, yeah, they want to know these things. And is this paid directly to you? So there's no personal injury billing or insurance. So basically they would pay for that and then they could put that in their own bills if you
That
will.
is correct.
Yeah.
Yes,
Okay.
they can put it in within their radiology portion of their billing. The reason why I don't do liens is I try to keep the pricing fair, and
Yeah.
then in doing so, I'm not going to wait 2 to 5 years for $40.
Right, right. No, it doesn't make
And-
fiscal sense, and you're not
yeah,
treating the client long term. So those are very
right,
reasonable prices, in my opinion. I think that anybody wouldn't even think twice about that, especially for case value and making sure that the patient's
right,
well taken care of. There's nothing worse than running a patient through a case, and then after everything's settled, then they find out that they had a more significant injury. No doctor would want to be responsible for that, and certainly an attorney. So
right.
it's a safeguard and it's ethical to make sure that you don't miss anything as much as you possibly can. And so great. Well, this is a great intro, MedLinks members. That's why we're here. We want to connect everybody who's specialists in this industry, so you don't have to go searching around and trying to find people on the Google or Chat GPT. Everybody's going to be right here, and we encourage you to also connect with each other. So it's not just about using the service. Get to know Dr. Pedley. Reach out to her, have a conversation, ask her questions. That's what we're all here for, is to learn and connect. Okay, well, thank you so much for that intro, and we'll let everybody start sending case studies to you.
All right. Thank you so much.